I wanted to record how bad the swelling is. It's swollen. It was not swollen like this when I went to the doctor. But by the time I got to the doctor, it had swollen up. So, I'm just documenting how badly it is. No, I don't have anything in my mouth swollen from both there forward to here. And no, nothing in my mouth. Just bad teeth. Doctor put me on a round of antibiotics and gave me T3s for the pain. This started day before yesterday as a toothache. Yesterday was throbbing toothache and a little bit of swelling in here, not like this, like you couldn't see it. I could just feel it on the inside. And then today, day 3, swollen up like this. I have to take meds 4 times a day now. Again. So I'm just documenting this because I go through this a lot and never documented it before for anybody. The only people that ever actually seen any of this is my husband and my kids. So I have a few more hours before I take another antibiotic and a T3 that makes me super loopy. And yeah. Can tell how my lip is, eh? So I don't know if the swelling will get any worse than this or if it'll stay like this. I have a ice pack and a giant thing of water. I can't take penicillin, amoxicillin, anything like that. I'm allergic, so I am on clindamycin. Not sure how well it would compare to amoxicillin or penicillin, how often. I have to take it 4 times a day for like 7 days. And span it out exactly. I usually take my meds at 12 and 6. And then again at 12 and 6. Can't lay down after you take them for at least 15 minutes. I can't have coffee with them because the T3s have they're acetaminophen coating caffeine, and you definitely don't want coffee with that. I made the mistake of giving in and having some last time, and I regretted it instantly. So I am set up on my bed in my room with my dog. You see the dog? Yeah, she kind of lays at the end of the bed. And I sit up and I stay sitting up. So, yeah, just for anybody that's like, oh, how bad is it? How bad could it possibly be? This bad. And if it gets any worse or any more swollen, I'll film again. And if if swelling starts to go down, I'll film again, keep track of the days, and put it together. Dentist quoted me 10 grand to pull my teeth and do dentures. So that's a lot of money. I'm not asking for money. I don't expect anybody to give me sympathy money. If you want to, I appreciate it. And I accept e-transfers. But that's not why I'm doing this. I just want people to see what it's actually like, because I normally hide. I don't go to the store. I'm back with another update. It's still day 2. I am 2 hours away from my next pill, and the swelling has gone into my lips. So from about here down to here, around, and it's starting to go up here. So it's like almost the size of my hand. I can't open my mouth. My lip hurts and it's swollen. And she's super swollen. It's hard to swallow. Eyes are swollen. Throat's swollen. See here, it's all swollen. This side's not swollen at all, but from here, all the way around up. Yeah, I think this is the worst it's ever been. That's not true. I had it go into my eye once before. So, since the last video update I did, I laid down to sleep, and I'm guessing that didn't help with the swelling at all. So, I might have to move to the couch so I can prop myself up better. Stop the swelling from going any further into my face. And, try to put an ice pack on it to help reduce it. This sucks, man. It's hard to talk. So, yep. In the last 12 hours, I went from basically no swelling, just a little bit right here, into this. Progressively getting worse. So, yeah. That's it. Hopefully the swelling goes down a little bit. In a couple hours, I get to take another antibiotic and another T3 for the pain soon. So, sucks. Yeah. I can't open. Time for another update. Still swollen, as you can see, but swelling has gone down a little bit in here. I can actually open my mouth a little bit. Still swollen back here and down into my neck here. Still pretty swollen. And swollen up this way a little bit now. So, See, it's a little swollen in here. Really swollen here still. Hard swollen there. The lip swelling went down a little bit. The swelling in my neck is going down a little bit. So, yeah. Day 2 of antibiotics. Cold compress to help with the swelling every now and then when it gets bad. Still on T3s for the pain. And yeah, not a whole lot happening right now with it, but looks a little bruised on my lips there. But that's nothing new. For everybody that said go to the ER, I have been to the ER before. I had the swelling go up like into my eye before, and the ER sends you home with an Advil and an antibiotic. So I will not be going to the ER as long as the swelling continues to go down the way it is. It's slow going, but it is going down a little bit. So, if it starts going up into my eye and gets bad, then maybe I'll consider the ER. But been through this before. Neck's like red. So yeah, no ER today. And I don't think I'll do another update unless the swelling actually like goes down more or goes up. Because my experience, it's going to be like this for the next day or two. And then eventually something inside will burst. It'll drain overnight and I'll wake up with like no swelling, just all of a sudden. At least that's what happened the last few times. So, thank you everybody for your concern and advice. I appreciate it. As I said before, the dentist quoted me $10,000 to pull all the teeth and get dentures because the teeth are like badly broken and they don't come out easy, so they have to be surgically removed one by one, and they're considered complicated, so it costs quite a bit. If you want to donate, I accept e-transfer to my email, queen-mia@outlook.com. Again, I'm not expecting anybody to actually donate or help. Only if you want to. So, yeah, that's it. That's this update, and then I'll see you next time. Alrighty, I'm doing another update. As you can see, my neck is slightly red. The infection is still kind of in my neck. It has gone down quite a bit. Still swollen here and hard here, but you can see that right in there. And there. The infection is draining, and that's disgusting. So that's a good sign. It is draining in my tooth there. I can actually open my mouth. I can talk. Eating still is painful. Not the easiest. I've had a couple pieces of bread with peanut butter and a little bit of soup because that's all I was able to eat so far. I'm almost done my 4 liters of water. Still have a few days of the antibiotics left, but the pain is controllable now, so I'm not taking the T3s. Last T3 I took was last night at 6, and it's now 7 a.m. So it's good. With any luck, this will continue to drain, and the hard from the infection here, because it's still hard right in here, all the way, still hard, but up here is soft and just poofy. Here though, hard. So hopefully this hard infection clears out. And yeah, hopefully I don't get another infection anytime soon. I'm chilling on the couch with my poofy dog. She always chills with me whenever I go through this. She stays with me. Isn't she cute? Yeah, get the camera out of your face. Okay. So yeah, it is slowly draining. My neck was extremely red all the way down here last night, and as you can see, it's only still a little bit red here and a little bit here. It's not nearly as red as it was. And this part that looks slightly discolored, still the color is slowly coming back, which is good. Discoloration on my lips is still kind of there, but not nearly as bad as it was. They don't look blue anymore. It didn't show up on camera, but in person, my lips here looked blue, like dark blue, from just the blood not being able to flow properly from the swelling. I haven't used the ice pack in a while, so the ice pack is now back in the fridge. And because I'm not taking the T3s, I should be able to have a coffee or a tea today. Yay. Haven't been smoking very much just because it hurts. It looks like I smoke a lot, but I actually haven't. I've had maybe a whole pack in the last 2 days, which is down quite a bit. I usually smoke about a pack a day. So yeah, that's this update. Swelling is coming down. You can see it still, but it's not nearly as bad as it was. So that's good. And not sure which day it is now. Today's Friday, and this started as a toothache on Monday night, Tuesday. Swollen up yesterday, Thursday, and badly Wednesday. So by Sunday it should be no swelling at all. We'll see. I will update when the swelling completely dissipates and how much meds I have left to take after the swelling goes down. So stay tuned. Time for another update. As you can see, the swelling is almost entirely gone now. It still feels hard right in here a little bit in the jaw from the infection. Right here to about here. That's it. Just that little line there. The swelling in my neck is gone. The swelling in my cheeks is gone. The swelling up here is gone. And my neck is no longer super red. Yay! I still have 2, maybe 3 days left of antibiotics to take. But as you can see, inside, still a bit, yuck. Inside is still a bit swollen, right in the gum line, right in there, just there. I can eat more than just soup now, which is good. Still can't eat anything hard, but that's not really anything new. And I lost a new piece of tooth from a different area. Right there. That one. I lost a chunk of tooth last night while eating a soft pasta salad. Don't ask how my teeth randomly crack and I randomly lose pieces. So, there's that. Smoker's cough. I am in the process of applying for health benefits, although the guy at the social aid whatever office that we were talking to said the odds of them covering to do all of my teeth is next to none. Usually the most that they'll ever cover is like a single emergency extraction to relieve pain. But we sent him the full treatment plan from my dentist from 2019, because that's the last time I went to see him. And we're going to go from there. Hopefully they approve us for some sort of benefits. I had applied separately for adult health benefits, child health benefits, and financial aid. I got a child health benefit card today in the mail. So the kids are covered for eye, dental, and prescriptions, which is good because my daughter's Vyvanse costs $100 and some a month, and then her sleeping meds, and then whatever other medication she gets put on or taken off of, and the kids each need a couple fillings. So we're taking care of the kids. I'm calling and booking an appointment with the dentist right after this update. So this is probably the last dental infection update that I'll do, but I'm going to keep updating if I get any kind of dental plan. Shout out to my mom. She is sending me like an essential oils package thing with I think it's oregano oil and frankincense. She says it's gonna help if I take them as capsules for, I think she said 10 days on and then however many days off and then 10 more days on to help prevent more infections from happening. So thank you, Mom. I'm looking forward to getting that. Before I take it, though, I am going to go and talk to my doctor. He is sending me for a whole bunch of blood work to find out what's going on with my anxiety. So before I take anything that my mom sent me, I have to double check that it's okay with my doctor and get all my tests done first. But thank you. Even if I don't take it, my husband will. I'll make him. So yeah, that is it. I can talk again. I still can't smile without a little bit of pain in here. And I was with the fundraiser freight group yesterday for about 4 hours, just for our meeting and trust exercise game. And because I love that group, they're like a second family. I spent 4 hours straight smiling because I haven't seen them since 2018, other than like in passing when I see somebody from the group at the store or online. So I spent 4 hours smiling and my face hurts just from smiling so much because there is infection left. So smiling hurts, but other than that, I'm doing good. The swelling in my throat is completely gone, including in my tonsils. It was getting scary not being able to swallow there for a little bit, but that's all good. The neck is all good. Nothing is swollen. So I'm happy. Gonna finish off my antibiotics, and then if I get any kind of yes, go ahead to extractions, or my mom is trying to fundraise, so we come up with a bunch of money to do any of the work that needs done, or if I get any extractions done, I'll do another update. So, hope you enjoyed.